Stop scrolling. Are you washing your face again and again, hoping acne and dark spots will disappear? You might actually be making them worse. I, as dermatologist Dr. Sandra Lee, explaining what really works. Many people believe that if their skin is oily or breaking out, the solution is to wash the face repeatedly throughout the day. It sounds logical. Oil causes acne, so removing the oil should solve the problem. But dermatology research and clinical experience show that overwashing your face can actually worsen acne, increase irritation, and even make dark spots more noticeable. Healthy skin depends on balance, and excessive cleansing disrupts that balance. Human skin naturally produces sebum, an oily substance secreted by sebaceous glands. Sebum plays an important protective role. It keeps the skin moisturized, maintains the skin barrier, and protects against environmental damage. When you wash your face too often, especially with harsh cleansers or scrubs, you strip away this protective layer. Your skin interprets that as damage and responds by producing even more oil to compensate. The result is a cycle where your skin becomes oilier and more prone to clogged pores. Acne develops when pores become blocked by excess sebum, dead skin cells, and bacteria, particularly Cutibacterium acnes. When the skin barrier becomes irritated due to overwashing, inflammation increases. Inflamed skin is more reactive, which means acne lesions can become more severe, redder, and slower to heal. This inflammation also increases the likelihood of post-inflammatory hyperpigmentation, the dark spots many people struggle with after acne heals. One of the biggest mistakes I see patients make is using strong foaming cleansers multiple times a day. Many of these products contain ingredients like sodium lauryl sulfate that remove oils aggressively. While they may leave the skin feeling extremely clean and tight, that tightness is actually a sign that the skin barrier has been stripped. When the barrier is compromised, moisture escapes more easily and irritation becomes more likely. The optimal approach for most people with acne-prone skin is washing the face twice daily. Once in the morning and once at night is typically sufficient. A gentle, non-comedogenic cleanser is ideal. Look for cleansers containing mild surfactants and soothing ingredients such as glycerin, ceramides, or niacinamide. These ingredients help cleanse the skin while maintaining its protective barrier. Another common habit that worsens acne and dark spots is aggressive scrubbing. Many people believe exfoliating harder will remove acne faster. In reality, mechanical irritation can worsen inflammation. When the skin is rubbed too aggressively, micro tears form in the surface layer. These tiny injuries trigger the body's inflammatory response, which can worsen existing acne and increase pigmentation afterward. Instead of harsh physical scrubs, dermatologists often recommend chemical exfoliants used appropriately. Salicylic acid is particularly effective for acne-prone skin because it penetrates into pores and helps dissolve oil and debris. At concentrations between 0.5% and 2%, salicylic acid can reduce clogged pores and decrease breakouts without causing excessive irritation when used properly. Glycolic acid and lactic acid are also beneficial ingredients for improving skin texture and helping fade dark spots. These alpha-hydroxy acids work by loosening the bonds between dead skin cells, allowing them to shed more evenly. Over time, this process can make pigmentation appear lighter and improve overall skin tone. Dark spots after acne, medically known as post-inflammatory hyperpigmentation, occur when inflammation stimulates melanocytes to produce excess melanin. This pigment then becomes deposited in the skin, creating brown or sometimes reddish marks. These spots are not scars, but they can last for weeks or even months if not treated properly. One of the most effective ingredients for fading dark spots is vitamin C. This antioxidant helps inhibit the enzyme tyrosinase, which plays a critical role in melanin production. Regular use of vitamin C serums can gradually brighten hyperpigmentation and protect the skin from environmental damage caused by ultraviolet radiation and pollution. Another scientifically supported ingredient for pigmentation is niacinamide. Niacinamide works by reducing the transfer of melanin from melanocytes to surrounding skin cells. In clinical studies, concentrations between 2% and 5% have been shown to improve uneven skin tone while also strengthening the skin barrier and reducing inflammation. Retinoids are another powerful option frequently recommended by dermatologists. Topical retinoids such as adapalene or tretinoin increase cell turnover, which means pigmented cells are shed more quickly and replaced by new ones. Retinoids also help prevent clogged pores, making them highly beneficial for people experiencing both acne and dark spots. However, when using retinoids, it is important to introduce them gradually. Many patients experience mild dryness or irritation during the first few weeks of use. This adjustment period is normal and can often be managed by applying the medication every other night and using a moisturizer to maintain skin hydration. Sun protection is one of the most critical yet frequently overlooked steps in treating dark spots. Ultraviolet exposure stimulates melanin production and can cause existing pigmentation to become darker and more persistent. Even small amounts of daily sun exposure accumulate over time, making sunscreen essential for anyone trying to fade hyperpigmentation. A broad-spectrum sunscreen with SPF 30 or higher should be applied every morning. Broad spectrum means the product protects against both UVA and UVB rays. UVA rays penetrate deeply into the skin and contribute significantly to pigmentation and premature aging, while UVB rays cause sunburn and direct DNA damage. For individuals dealing with stubborn dark spots, certain prescription treatments may be recommended by dermatologists. Hydroquinone is considered one of the most effective skin lightening agents available. It works by inhibiting tyrosinase and reducing melanin production. When used under medical supervision, hydroquinone can significantly lighten hyperpigmentation over several weeks. Azelaic acid is another clinically proven treatment that benefits both acne and pigmentation. It has antibacterial, anti-inflammatory, and skin lightening properties. Studies have shown that concentrations between 15% and 20% can reduce acne lesions, while also improving post-inflammatory hyperpigmentation. In addition to topical treatments, lifestyle factors also influence acne and skin healing. Diet, stress levels, sleep quality, and hormonal balance all play roles in skin health. Some research suggests that high glycemic index foods, such as sugary snacks and refined carbohydrates, may worsen acne in certain individuals by increasing insulin levels and stimulating sebum production. Dairy consumption has also been associated with acne in some studies, possibly due to hormones present in milk that can influence androgen activity. While dietary triggers vary between individuals, paying attention to how your skin responds to certain foods can sometimes help identify patterns that contribute to breakouts. Stress is another significant factor. When stress levels rise, the body releases cortisol and other hormones that can stimulate oil glands and increase inflammation. This hormonal response can lead to more frequent breakouts and slower healing of existing acne lesions. Adequate sleep and proper hydration support skin repair processes. During sleep, the body produces growth hormones that help repair damaged tissues and regulate inflammation. Chronic sleep deprivation can impair these processes and contribute to dull, stressed skin. Many people searching for fast ways to remove dark spots are tempted by harsh DIY remedies such as lemon juice, baking soda, or undiluted essential oils. While these ingredients are often promoted online as natural solutions, they can cause irritation, chemical burns, and worsening pigmentation when applied directly to the skin. Lemon juice, for example, is highly acidic and can disrupt the skin barrier. When exposed to sunlight, compounds in citrus fruits can trigger a reaction called phytophotodermatitis, leading to severe pigmentation and inflammation. Dermatologists strongly advise against applying raw citrus to the skin. A safer approach involves consistent use of proven ingredients combined with patience. Most hyperpigmentation treatments require several weeks to show noticeable improvement because the skin renews itself gradually. Typically, it takes about 28 days for a full skin cell turnover cycle in younger individuals, and slightly longer as we age. Consistency is far more important than using aggressive treatments. A gentle routine that includes a mild cleanser, targeted treatment ingredients, moisturizer, and daily sunscreen can gradually restore the skin's balance and reduce both acne and dark spots. Moisturizing is particularly important for acne-prone individuals, even though many people believe oily skin does not need hydration. In reality, when the skin becomes dehydrated, it may compensate by producing even more oil. Lightweight, non-comedogenic moisturizers containing ingredients such as hyaluronic acid and ceramides help maintain proper hydration without clogging pores. Hyaluronic acid is especially useful because it can hold up to 1,000 times its weight in water. By attracting moisture to the skin's surface, it helps maintain plumpness and supports barrier function. When the skin barrier is strong, it becomes less reactive and better able to heal from acne lesions. Ultimately, treating acne and dark spots requires a balanced approach based on dermatological science rather than harsh cleansing or quick fixes. Overwashing can disrupt the delicate balance of the skin, worsen inflammation, and prolong the healing process. Gentle care, targeted treatments, and sun protection provide far better results over time. Understanding your skin and treating it with patience and consistency can make a significant difference. Acne and pigmentation do not disappear overnight, but with the right routine and evidence-based ingredients, clearer and more even-toned skin is achievable. Dermatology focuses not on extreme solutions, but on protecting the skin's natural barrier while guiding it back to a healthy, balanced state.